Hello and welcome. Today, we're diving into a rare and complex neurological disorder called Lesch-Nyhan syndrome. It's a condition that impacts many aspects of a person's life, and understanding it is crucial for both medical professionals and anyone interested in learning about neurological diseases. Lesch-Nyhan syndrome is caused by a deficiency of an enzyme called hypoxanthine guanine phosphorybosyltransferase, or HGPRT for short. This enzyme is essential for recycling purines, which are building blocks of DNA and RNA. The deficiency is due to a mutation in the HPRT1 gene, located on the X chromosome. Because it's an X-linked recessive disorder, it predominantly affects males. Females can be carriers if they have one copy of the mutated gene. The HGPRT enzyme plays a crucial role in the brain, particularly in the basal ganglia, a region involved in motor control, behavior, and cognition. When HGPRT is deficient, purines accumulate in the body, especially in the brain. This buildup disrupts normal brain development and function. The exact mechanisms leading to the neurological and behavioral symptoms are complex and not fully understood, but it's believed that altered dopamine levels and neuronal dysfunction are key factors. Lesch-Nyhan syndrome is extremely rare. It's estimated to affect approximately 1 in 380,000 live births. Because it's X-linked recessive, it predominantly affects males. While carrier females are typically asymptomatic, they have a 50% chance of passing the mutated gene to their sons. The signs and symptoms of Lesch-Nyhan syndrome are often devastating and become apparent within the first year of life. One of the earliest signs can be orange sand, like crystals in the diaper, which are uric acid crystals. Neurological symptoms include hypotonia, or low muscle tone, followed by developmental delay and involuntary movements like chorea and dystonia. A hallmark of Lesch-Nyhan syndrome is self-injurious behavior, which can manifest as compulsive biting of the lips, fingers, and hands, as well as head banging. Intellectual disability is also common. Individuals with Lesch syndrome may also experience gout, kidney stones, and other kidney-related problems due to the elevated levels of uric acid. Diagnosis typically involves a combination of clinical evaluation and laboratory testing. The presence of characteristic signs and symptoms, such as self-injurious behavior and movement disorders, raises suspicion. Blood tests can measure uric acid levels, which are usually elevated. However, the definitive diagnosis is made by measuring HGPRT enzyme activity in red blood cells or fibroblasts. Genetic testing to identify mutations in the HP1 gene can also confirm the diagnosis, particularly in cases where enzyme activity levels are inconclusive. Lesch-Nyhan syndrome doesn't have distinct subtypes. It is generally classified by severity of symptoms. There are variants in the levels of HPRT deficiency, but most people with a mutation that results in Lesch-Nyhan syndrome have a complete or near-complete deficiency that manifests in similar symptoms. Currently, there is no cure for Lesch-Nyhan syndrome, and treatment focuses on managing the symptoms. Allopurinol can help reduce uric acid levels and prevent gout and kidney stones. However, it doesn't address the neurological or behavioral problems. Management of neurological symptoms involves medications to control involuntary movements and spasticity. Behavioral interventions, including physical restraints, dental protection, and behavior modification therapies, are crucial to prevent self-injury. Occupational therapy and physical therapy can help improve motor skills and function. A multidisciplinary team of specialists, including neurologists, psychiatrists, therapists, and geneticists, is essential for providing comprehensive care. Since Lesch-Nyhan syndrome is a genetic disorder, there is no way to prevent it from occurring in an individual carrying the mutated gene. However, genetic counseling is crucial for families with a history of the syndrome. Carrier testing can identify women who carry the mutated gene. Prenatal testing, such as chorionic villus sampling or amniocentesis, can determine if a fetus has the condition. The prognosis for individuals with Lesch-Nyhan syndrome is often challenging. The neurological and behavioral problems are typically lifelong, and self-injurious behavior can be difficult to manage. The level of intellectual disability varies, but it often limits independence. While life expectancy can vary, with proper medical management and behavioral interventions, individuals can live into adulthood. Recent research has focused on gene therapy and other potential treatments targeting the underlying HGPRT deficiency. While these approaches are still in the early stages of development, they hold promise for improving the lives of individuals with Lesch-Nyhan syndrome in the future.